Hi, I'm Maddie.
I'm Cassidy.
And I'm Rebecca.
And our national patient safety goal is to use alarms safely.
So, our overview will be going over what is the National Patient Safety Goal, why it is important, the challenges that occur with safety alarms, safety improvement, clinical judgment, including the nursing process, leadership, patient centeredness, health promotion, implementation, clinical site, and then we have our conclusion and resources.
So the National Patient Safety Goal is to use alarms safely. The overall goal is to make improvements to ensure that alarms on medical equipment are heard and responded to on time. Alarm systems alert caregivers of potential patient problems, but if they are not properly managed, they can put patients at a higher risk. Alarm sounds can be difficult to detect due to the high use of alarms in this setting. Using alarms safely is an important issue for hospitals to recognize, and hospitals should implement a plan of action that leads to reduced errors and overall better response to alarm usage.
Our objectives that we have are explaining how bed alarms are implemented into the healthcare setting. Bed alarms in healthcare settings are implemented to alert staff when a patient attempts to leave or move out of bed, helping prevent falls and ensure patient safety. And explaining the side effects of alarms in the healthcare system and how they affect the performance of nurses. The constant noise from alarms in healthcare setting can lead to alarm fatigue, causing nurses to become desensitized to alerts, which may reduce their responsiveness and overall performance in patient care.
So why is alarm safety important? Healthcare environments are full of alarm systems. Some of the types of alarms are patient safety alarms, which alert if the patient gets out of bed or their chair or if they change positions. This just depends on like what level of risk the patient is. You also have vital sign alarms, which alert when patients' vitals have changed. Dosage and timing alarms, which alert when the dosage is if the dosage is safe or not, or when to administer medication. And then alarms for malfunction, so low batteries or if an infusion pump is not delivering fluids. And then this puts patients at higher risk, so improper management of alarms, incorrect alarm setting, alarm fatigue, missed alarms, and lack of training. So safety, ways to reduce the risk of harm to patients and providers with consideration for professional standards when it comes to safely using alarms. So it's important to see what works best for the medical staff that will be implementing the alarms, and then also creating a process to customize alarm settings based on the individual patient's needs. So just depending, um, I guess, what level of risk they're at. And then encouraging patients and families to notify staff when an alarm signal is not being addressed in a timely manner. The role of the nurse in supporting patient safety. So the nurse can assess the risk level of the patient. This can depend on their age, their mobility, cognitive status, current medications they're on, and their medical condition. They should monitor and respond to alarms promptly. They are to ensure that alarms are activated and set to the proper settings specific to the patient. They are also responsible for educating the patient on the appropriate use of the alarm, and then explaining to patients why they need the alarm, and this will improve patient adherence and can decrease confusion. And then also, the nurse's role is to accurately document if bed alarms are activated or failed to trigger.
So, problems when using alarms are one of them is alarm fatigue. Alarm fatigue is when someone becomes desensitized to safety alerts, which can lead to missed alarms or delayed response. Another one is improper calibration of bed alarms. Ensuring that bed alarms are routinely checked, tested, and recalibrated can help prevent both false positives and false negatives. Patient complications. Bed alarms are demeaning, similar to putting the patient in a cage, and deface the dignity of an individual. The noise can actually scare a person with dementia into falling.
So for the clinical judgment, I apply the nursing process to using alarms safely. So for assessment, the nurse would assess how the current alarm systems in the workplace impact patient care and safety. So you can speak with staff members about their experiences with alarm systems and get their feedback on the existing protocols. And then for diagnosis, it would be identifying what problems could be impacting patient safety caused by alarm systems, so either alarms being missed or fatigue staff. You can do this by identifying whether alarm overload or a lack of customization contributes to missed or delayed responses. For the planning part of the nursing process, you can develop a plan to address the alarm-related issues identified during the assessment and diagnosis phases. For the implementation part, implementing a plan by adjusting alarm settings for patients and assisting with customizing settings to improve alarm response. So you can do this by leading or participating in staff training sessions on alarm systems. And then for the evaluation part, evaluating whether the alarm safety strategies have successfully improved patient safety by monitoring alarm system performance and reporting any technical issues that need attention.
Okay, what are ways that leadership impacts the use of safety alarms? Actively participating in safety protocols. You can do this by using equipment properly and keeping up to date on proper training and changes. Openly communicating concerns. Examples of this is if a patient is at high risk and you believe they require an alarm, or if an alarm is not working, to try an alternate one. Collaboration, fostering collaboration among healthcare professionals to ensure a shared understanding of alarm management protocols, and to encourage open communication among staff regarding alarm issues and potential solutions. And then leading by example, so following proper alarm procedures and encouraging peers to stay informed and comply with policy. Patient-centeredness, it is important to always consider your patient when implementing alarms, ensuring that they have a solid understanding of how alarms work and why they are there will help the patient to know how to respond when the alarm goes off. If your patient is hindered in using alarms, such as a call light, they may need a more extensive use alarm, such as a bed alarm. Some patients may become agitated when alarms go off in their room, and it's important to know this beforehand. And advocating for your patient with how they respond to alarms and what changes might need to be made will both keep your patient safe and allow them to feel included in the plan of care.
For health promotion, we have develop evidence-based teaching plans to manage health and promote quality of life. Health promotion for bed alarms focuses on educating healthcare staff and patients about their proper use, ensuring timely response to alerts, and regularly maintaining the systems to enhance patient safety and reduce fall-related injuries. To develop evidence-based teaching plans for managing health and promoting quality of life with bed alarms, incorporate research on alarm effectiveness, best practices for reducing alarm fatigue, and strategies to educate staff and patients on proper use, ensuring it enhances safety without causing distress. Implementation. You want to thoroughly train staff on alarm management. To do this, you can provide opportunities for staff to practice responding to alarms in simulated environments using real equipment and scenarios. You want to ensure proper equipment maintenance. To this, you want to focus on equipment familiarization, safety protocols, maintenance procedures, and regular refresher training, using a combination of practical on-the-job experience and formal training sessions. And you also want to set alarm prioritization. You want to categorize alarms based on their potential impact on patient safety, environment, and operations.
All right, for our clinical site, we chose Powell Valley Healthcare. We spoke to the house supervisor, and one thing we asked was, how is the clinical site we have chosen working on implementing the patient safety goal? His response was initial and on-the-job training. This includes knowing how to set them, when to use them, and how to respond to alarms properly. We also asked if there's any policies or guidelines used to implement and ensure goal achievement. And his response was they have a group called the Unit Practice Council, and what they do is they try to implement different policies to rework and keep up with standards. Along with this, they also have safety committees and safety councils to go over and review alarms and make sure they're up to date on that.
These are our resources.
We have 4 of them.
Thank you.
Thank you.
Thank you.